Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase how communities are taking on the coronavirus. We also break down the major headlines. Today, new jobs numbers. The government recorded 2.4 million new unemployment claims last week. The rate has declined for 7 weeks in a row. 38.6 million people have filed for unemployment since the pandemic started. Questions about how 4 states are tallying coronavirus cases. Virginia, Texas, Georgia, and Vermont have all said they're combining viral test results with antibody test results. Viral tests look for evidence of an active infection, whereas antibody tests look for evidence of a past infection. Critics worry it could misrepresent when and how the virus spread and a state's testing levels. Almost half of tweets about coronavirus seem to come from bots. Researchers at Carnegie Mellon University studied more than 200 million such tweets posted since January and estimate about 45% of the accounts are bots. Researchers are still trying to figure out where the bot accounts originate and say this level of activity is up to double what they've seen in previous crises. We mentioned the new unemployment numbers. People receiving those benefits could get a surprise bill next year unless they take a specific step. Alicia Nieves has the warning about taxes.
Despite nearly every state starting to reopen, millions of Americans are still losing their jobs. The Department of Labor's latest report shows another 2.4 million new jobless claims were filed last week, while there were still more than 22 million continued claims. Essentially, 22 million people already receiving unemployment benefits.
This is something that certainly tax practitioners are looking at.
Bob Probasco with the tax clinic at Texas A&M University is one of the many tax experts paying attention to the unemployment numbers because the higher they get, the more people who may have tax troubles next year.
It's going to affect a lot of people who don't realize that unemployment income is taxable.
You don't have to pay Social Security or Medicare taxes on unemployment benefits, but you do have to pay federal and sometimes state taxes.
A lot of people, if they're just withholding 10%, that will get them pretty much where they need to be.
But if you don't opt to withhold taxes from your unemployment benefits now, you are in jeopardy of having a hefty tax bill next year and dealing with 3 potentially costly tax penalties. A penalty for not paying in advance, a penalty if you can't pay the tax bill come April 2021, and a penalty if you attempt to avoid the problem by not filing.
Biggest problem is if you get to the end of the year, you can't afford to pay it, and you talk yourself into not filing the return. It doesn't matter if you can't pay it, at least file the return. That's the big one. That's what really hits people.
To avoid all of that mess next tax season, there are a few things you can do right now.
There is an opportunity to go ahead and have withholding taken out of the unemployment. There's a special form, a form W4V. They can get that on the IRS website, irs.gov.
This W4V form is one that you have to fill out and send to your state's respective unemployment office. Another option in some states may be that when you recertify for benefits each week, well, you may be able to opt into withholding taxes then. Now, if you are someone who just cannot afford to have taxes withheld from your unemployment benefits right now, well, Probasco and other tax experts understand. He says, do what you have to do right now. Times are tough. It's just important to understand what your tax situation may be come next April. I'm Alicia Nieves reporting.
There are so many efforts right now to keep this virus from spreading, and that includes the use of contact tracing. That technique works to find out how a patient became exposed and whether they may have exposed other people to a disease or virus. It essentially breaks the chain of infection. Schools like Johns Hopkins and the University of Houston are offering free courses that train people on how to do this. The classes teach effective communication as well as risk management, communication, privacy issues surrounding patients' health.
You need to understand enough about the virus to understand how to stop its spread. You have to be able to talk to people, establish rapport, get information. And there are also some very important ethical and privacy issues that are very important to understand.
One professor teaching the same class at the University of Houston says these skills aren't only useful in this pandemic.
Contact tracing is still used during epidemics, and it might be minor outbreaks of foodborne illnesses. Contact tracing is used for tuberculosis or STDs. So there's a myriad of ways that those skills can be applied moving forward.
All you need to take part in these courses is a high school degree. Right now, the U.S. needs about 100,000 to 300,000 contact tracers. You do need a certificate before you get hired. Contact tracers can earn up to $65,000 a year. A group of property managers helping millions pay their rent. Guy Beach shows us how the group is helping people financially and emotionally.
There's me when I was with the 82nd Airborne.
After serving his country on the front lines,
Fort Bragg, North Carolina, in the U.S. Army,
Stephen Rogers found himself facing hard times.
I've had 4 back surgeries and 1 open heart surgery.
This military veteran suffered multiple injuries from his time as a paratrooper in the U.S. Army. But Rogers really went from suffering physically to financially when his mother passed away.
I had to help support her in the convalescent home as well as her funeral, and then I encountered medical expenses from my injuries.
Approaching my apartment.
Just 4 days away from facing eviction, Rogers says he was saved by the Resident Relief Foundation, a national nonprofit helping people pay their rent.
It's simply a grant for a responsible renter who finds themselves in a really tough situation.
Michelle Ling is with the Colorado Apartment Association, a group that partnered with the Resident Relief Foundation. With millions of Americans out of work and filing for unemployment during the coronavirus pandemic, Ling says the goal is to raise $10 million to help renters across the country.
This particular grant program is for renters who have a strong rental history, who just find themselves in an emergency situation. And frankly, I can't think of a more emergent situation than COVID-19.
To qualify for this program, you have to be facing eviction within 21 days, be a resident in your community for at least 9 months, paid your rent on time every month for the last 5 years, and also complete a financial literacy program, something Rogers says has really helped him.
And when you get this education, you start thinking differently about, your finances and how to move forward.
Moving forward, Rogers no longer needs help paying his rent, and will refer others to this program. For more information or to donate, visit residentrelieffoundation.org. I'm Kai Beach reporting.
The CDC has new information about how coronavirus may spread, what it says about surfaces and objects you may touch, and the idea of testing wastewater for coronavirus is taking off, how it could help in the fight against this pandemic next.
RF.org.
It's an idea that has spread quickly across the country. Test city wastewater for the presence of the coronavirus. What started in Arizona is now showing promise in more than 40 states. Some believe it's a more inclusive form of testing as it uses a much bigger sample of the population. Dan Grossman takes a look at what new data out this week reveals about infection numbers.
This is a story about the importance of flushing, what goes down, and the information.
It was absolutely fascinating to me.
That then comes up.
I did not make the connection between the pandemic and the work we do at a wastewater facility, but I'm glad we found the connection.
This is Peter Van Rye. He's a waste management director in Colorado. We'll come back to him in just a second. First, you might be asking, what connection is he talking about? As it turns out, every flush of waste isn't just a deposit in the sewage system, but one in the lab.
To us, it's just crazy not to leverage the opportunity.
Mariana Matusa's lab, called BioBot, located in Boston to be exact.
Every time we use the toilet, we're sending away valuable information about our health.
So this is an auto sampler.
BioBot has been testing wastewater for COVID-19 since March and gets sewage samples from more than 400 locations like Peters in 42 states. The idea is to get a broader sample since not everyone gets tested for the virus at testing sites. BioBot says its facilities sample around 10% of the U.S. population. In-person testing has sampled just under 4%.
It's interesting to be able to test it from a different angle. I didn't think we were going to have an integral part in trying to establish where the virus might be within our community.
has learned a lot from its testing. Just this week, their data indicates COVID-19 has infected 10 times as many people as CDC numbers show. Granted, that number isn't perfect, but it gives insight into not only the virus, but the policies used to contain it.
We believe that the main use of the data in the immediate future will be to understand the impact of these policy decisions, which is going to be balancing the mitigation, the social distancing to keep the outbreak low, but also enabling the economy to operate to some level.
BioBot says things like sample dilution need to be considered as it refines its process. But they're hoping with each week, projections and real-time monitoring become even more precise as each flush becomes more valuable.
We want to make this a tool where our leaders, really the people making those policy decisions have the best data available and can quickly react to our new reality.
I'm Dan Grossman reporting.
As leaders discuss what's next in coronavirus relief, one economic expert says targeted spending could help aid the recovery. Jim Angel is a finance professor at George Washington University. He thinks future stimulus bills should invest in new public works and infrastructure programs, creating jobs like the ones created during the Great Depression. He says jobs like fixing roads and bridges and improving parks help workers now and create a long-term benefit for everyone. The professor points out infrastructure jobs include more than just construction.
It isn't just using a shovel. Don't forget you need very experienced machine operators, and also don't forget the engineers who have to design the roads and bridges, and of course don't forget the 5,000 lawyers to deal with all the litigation involved. So there's plenty of work to be done here.
The newest stimulus proposal recently passed the House but isn't expected to pass the Senate. The HEROES Act calls for a new round of $1,200 stimulus payments to all eligible individuals, plus more than $1 trillion for local and state governments. If it becomes law, it would be the largest economic stimulus bill ever in American history. The CDC is giving more information on how coronavirus might spread. It updated its guidelines to say the virus mainly spreads from person to person, even in people who aren't showing symptoms. It says the virus, quote, does not spread easily via contaminated surfaces or objects. That doesn't mean the virus doesn't spread that way. The CDC says it still can. For prevention, it recommends social distancing, frequent hand washing, and disinfecting frequently touched surfaces. Researchers say unproven stem cell products are being pushed as treatment for coronavirus. Melissa Messia shows us what's on the market right now that experts say to avoid.
There's still a lot unknown about the coronavirus. That's leading to some companies taking advantage of those worried they may catch it.
I think these businesses kind of tap into very vulnerable populations, people who are looking for help. Maybe they're hopeful, maybe they're desperate.
Lee Turner is a bioethicist at the University of Minnesota. He's been studying the marketing of stem cell therapies and related products for nearly a decade. His recent paper about businesses selling unproven and unlicensed stem cell treatments for COVID-19 recently appeared in the journal Cell Stem Cell.
They're basically making marketing representations that aren't compliant with federal law. They're not accurate. They're not evidence-based.
His research states businesses make vague claims on their websites about stem cell treatments for COVID-19. Turner mentions one Southern California anti-aging clinic using YouTube videos to promote stem cell exosome products it ships to its clients' homes. He said an Arizona regenerative medicine clinic is advertising stem cell therapy as a precautionary measure for preventing COVID. The list goes on from Florida to Pennsylvania and Delaware. Turner calls linking these treatments to COVID-19 deceptive.
Is it illegal or is it unethical?
Yeah, so I think it's both illegal and unethical.
On its website, the FDA warns of various products companies claim help with COVID-19. The agency also sent warning letters to businesses in several states that made unsubstantiated claims for coronavirus prevention or treatment.
Do everything you can to avoid being scammed, because this is a moment where there are a lot of people out there trying to do helpful things in all kinds of ways, but there are other individuals who see this as an opportunity to make money.
A trip to the dentist will now look very different. The changes that will impact your visit and what you should know about a possible coronavirus surcharge.
Make a donation or volunteer today.
Virtual check-ins, reduced staff, and more sanitization. Your next trip to the dentist will look very different from your last. Dentists' offices are working to protect themselves, but also you. Amanda Brandeis looks at what you can expect and the question to ask about a COVID-19 extra charge before you get in the chair.
Sorry. At this dentist office,
so it's good to see you guys all back.
It feels like the first day of school.
One of the best ways we can keep the office safe is to make sure that the virus is outside of the office.
After being home for weeks, staff must learn how to do their jobs in a pandemic.
Cavities haven't paused, gum disease hasn't paused. Little cavities have turned into big cavities. Big cavities have turned into infections and swellings.
Dr. Kami Haas is co-founder of the Super Dentist, a practice for kids. They've modified nearly every aspect of the patient experience.
In some cases, the waiting room could be your car. At this office, patients will wait until they get a text message letting them know it's time for their appointment.
And in the meantime, patients can fill out paperwork on their phone.
We are at a very high-risk profession. But on the flip side of it, it's something that we've had to deal with for decades, right?
The goal is to keep sick people out of the office. Patients can expect a screening over the phone and also in person, asking if they've been exposed to COVID-19 or have any symptoms.
97.3.
The actual waiting room will no longer have magazines, coffee, or toys.
On the patient side, it's going to be fairly safe. It's really mostly the dentists that are going to be at risk or the hygienists, and that's where they're going to be wearing a lot of great PPEs.
This protective gear also protects the patient in case their provider has the virus. Some offices are charging patients a $10 to $15 fee to cover the added cost. The American Dental Association urges them to disclose this to patients up front. As for procedures, some like fillings and teeth cleanings will be modified to reduce aerosols, the tiny droplets of saliva and water that come from a patient's mouth. Dr. Haas will be using a high-tech machine to suction these liquid droplets. He's also upgraded the ventilation system and installed UV light cleaning technology.
We've done all of those additional things because we want to make sure we create an environment that I feel comfortable having my own family here, and I feel like we're there.
He wants patients to know the dentist office is safe. And after weeks of delayed appointments, avoiding care could do more harm than good. In San Diego, I'm Amanda Brandeis reporting.
The American Dental Association is asking insurance companies to help dentists cover the increased cost of personal protective gear. Let your dentist know if you have any symptoms before your visit and if you develop symptoms up to 14 days after your visit. Well, he's known as the happiness guy, hanging these signs around one town. How he hopes they will influence the people who see them.
And Keller. Right now.
Welcome back. We like to end the rundown with stories that remind us of the good going on all around us. Today, a man hanging a simple but powerful sign around St. Petersburg, Florida. Gary King is known as the happiness guy around town. He's put up more than 80 of his happiness signs as an experiment to help others and himself.
Everything you take in creates an emotion. The whole idea is to create emotions that make you healthy physically and healthy emotionally. And if you look at the word long enough, you'll change your behavior.
He encourages people to try it at home. He says to put a sign with just the word happiness on your mirror or on the fridge and see how long it takes to notice a difference. Well, that's all the time we have today for Coronavirus, The Rundown. We'll see you next time. I'm Usher Qureshi. Thank you for joining us.